Hey guys, you can see I've kind of lost a little weight and looking kind of but that's because I've been really sick. I have a disease called Crohn's disease, and instead of me explaining it and getting flustered, I'm going to show you a video that I found online. Now this is not my video, but it's a video to explain it a little bit better than I can. So here it is.
Crohn's disease is an inflammatory bowel disease characterized by chronic inflammation of a portion of the GI tract. Unlike ulcerative colitis, Crohn's disease can affect any area of the GI tract. But one of the most common sites of involvement is the terminal ileum. The rectum is characteristically sparse. Crohn's disease is characterized by transmural inflammation. Findings of granulomas are also highly specific for Crohn's disease. Unlike ulcerative colitis, which is characterized by continuous stepwise lesions, Crohn's disease is characterized by multiple separate regions of disease called skip lesions. This pairing of interspersed mucosa results in a coarsely textured cobblestone appearance. Fissures commonly develop between mucosal folds and can extend deeply to become fistular tracts. Perianal disease is especially common in Crohn's. In case of extensive transmural disease, the mesenteric fat can be involved and extend around the serosal surface, commonly called creeping fat. On histologic examination, multiple large lymphoid aggregates can be found. On barium swallow, string sign can be indicative of Crohn's. To sum up, Crohn's disease most commonly manifests in the terminal ileum and colon, typically sparing the rectum. Characteristics of the disease include transmural inflammation, granulomas, and skip lesions. A common stone appearance is seen in the mucosa. Fissures, perianal disease, and creeping fat are also observed in patients. Lymphoid aggregates can be seen on histologic examination, while string sign on barium swallow can also indicate Crohn's. Crohn's disease assessment. This condition is an inflammatory bowel disorder that involves any segment of the GI tract, but it is usually found in the terminal ileum. This disease is characteristic symptom of non-bloody diarrhea. Patients with this condition often produce loose stools that contain large amounts of fat due to malabsorption, which is termed steatorrhea. This can occur up to 5 to 6 times per day. They may also experience cramping abdominal pain. A lower grade fever may also occur, along with weight loss. Weight loss occurs as a result of the frequent stooling and decreased absorption of calories, as malabsorption is common. This leads to nutritional deficiency, especially of fat-soluble vitamins A, D, E, and K. As this disease often affects the small intestine, where these nutrients are absorbed. Anemia may also occur as B12 is primarily absorbed in the terminal ileum, the most common primary site of Crohn's inflammatory process. Possible complications of this disease include obstruction, which result from inflammation that leads to scarring and stricture formation. Intestinal obstructions often require surgical intervention. Fistulas are another possible complication and are defined as abnormal openings between two adjacent hollow organs. Fistulas often create high-risk scenarios for urinary tract infections, peritonitis, or abscesses depending on where the fistula is located. So to recap, Crohn's disease is an inflammatory bowel disorder that results in a non-bloody diarrhea 5 to 6 times per day. Patients often experience cramping abdominal pain, fever,